So like she was saying, my name is Rebecca Soine. I am a dermatologist. I primarily practice out of Hammond, Louisiana at a medical dermatology practice. And I am a LSU clinical assistant professor, and we spend time doing the cutaneous lymphoma clinic with both LSU and Tulane residents. I don't do a lot of public speaking on purpose, so please be patient with me. I am new to this. So I'm looking forward to discussing this next topic with you guys, and we'll just go straight into the quality of life issues. As dermatologists, we know that certain skin conditions like chronic, non-curable ones, atopic dermatitis, psoriasis, can affect quality of life in patients. And we know that cancer can affect quality of life in patients. So it is reasonable to assume that cutaneous lymphomas will also affect quality of life in patients. Furthermore, cutaneous lymphoma is a chronic non-curable skin disease plus a cancer, so that burden or impact on quality of life can even be greater than what would be typically expected. So my goals of this talk today are to define quality of life issues, briefly discuss how we study and measure them, review a few selected studies on this topic, and address some strategies to target the common offenders that impact quality of life in lymphoma patients. And then finally, we'll discuss an ideal patient-provider interaction. So first up, what are we really talking about when we say quality of life? And we are specifically talking about social, emotional effects and physical effects of a disease. For example, how a disease affects socialization with friends and others. Does a disease contribute to depression, fear, embarrassment, and anger? Are symptoms of a disease physically uncomfortable, like pain, itch, or burning? And are patients physically limited from functioning in their work or home roles due to a condition? And we talk about skin disease and impact on quality of life. I like to reference this diagram. This diagram comes from an article detailing the Skin Index, which is a questionnaire that evaluates quality of life, and they kind of divided quality of life into these three domains: so symptoms, emotion, and functioning. So symptoms being the things that are a little bit easier to measure, like itching, burning, pain, irritation. Emotion, worried, embarrassment, ashamed, frustrated, depression. And functioning, how this affects your ability to function at work or at home, how you function with your sleep patterns and day-to-day activities. So now that we know what we're talking about with quality of life, let's review how we study and measure quality of life. It can be challenging to study and measure these non-tangible items, and at the 2018 Cutaneous Lymphoma Foundation Conference in San Diego, we spent a lot of time discussing the how to measure these things. The gist is, it is very difficult. A lot of time and money is spent in research arenas developing surveys and questionnaires that can reliably and consistently gauge quality of life issues. These tests must undergo a lot of formal testing to make sure that they can be verified and accurately perform amongst a broad population of people with different disease states, as well as educational backgrounds. So for now, the surveys and questionnaires are the best that we have, and they are limited in gauging the quality of life. This slide is from the Cutaneous Lymphoma Foundation survey in 2005, and I put it in here to show you like snippets or examples of what would be in these questionnaires. Did anybody participate in that survey in 2005? It was about 1,000 people around the country. So responders to these questionnaires would rate, like my skin is sensitive, they would give it a 1 through 3 or 1 through 5. And then those items are recorded and calculated into a numerical value. So now that we survived some of the technical talk about what it is and how we measure quality of life, we can review a few of the selected studies on the topic. Our first article is from Dr. Duvik at MD Anderson in 2001. And this study was primarily geared to evaluate whether or not bexarotene or targretin would be effective in treating CTCL. And in fact, the authors noted that 54% of people treated with bexarotene had improvement in their disease. Participants in this study were given a 6-question survey after receiving the bexarotene to gauge the patient perspective of improvement with the medication. And interestingly, the patients reported an overall improvement in their itch consistently. And then 95% of the patients said that they thought they were improved on this medication. So it's just really interesting that the doctors or researchers said only 54% got better on this medicine, but the patients who were receiving them had a much higher rate of improvement. And so considering that it's possible that the researchers were overlooking some of the things that affect quality of life, like itch and discomfort, and just looking at the skin to gauge improvement. The next study comes to us from Boston in 2005. Dr. Demier and her team used a verified, reliable, skin-specific questionnaire called the Skindex and the FACT-G questionnaire to determine if CTCL had an impact on patients' quality of life. And yes, it does. CTCL has a consistent, reliable impact on quality of life. And it appeared that the quality of life issues worsened with more advanced stages of disease, which I think pretty much would make sense, and we would all agree with that concept. In 2005, the Cutaneous Lymphoma Foundation published results of a 4-page survey that they sent out to all 930 members of the organization. Of the 930 members that were targeted with this survey, 632 surveys were actually completed and returned. And that is a 68% response rate, which is pretty good for a questionnaire. And you can see the results are as follows. 94% were worried about their disease. 88% were bothered by itch. 66% were tired and had effects on their sleep. And 61% of patients felt financially burdened by their disease. The majority of patients also reported that their symptoms affected their clothing choices, interfered with their jobs, limited their normal daily activities, and had a significant impact on their social function or social interactions. There were other findings too. I just took out the highlights from it. The next study that we have is out of the British Journal of Dermatology. Dr. Sampoga noted that women reported worse scores than men, even when age and stage were similar, and patients with anxiety and depression reported worse scores than the non-afflicted population. And finally, another study by Dr. Demier and her team. They designed a study that evaluated quality of life at 2 points in time, before and after treatment. And they noticed that, yes, quality of life does have a negative impact. CTCL does have a negative impact on quality of life, but it can be improved with appropriate treatments, because they showed an improvement in their scores when effective treatments were applied. So there are more studies out there. We'll not go over those today for the context of this talk, but I think these studies show a good evolution of the care. the articles, the histories suggest that, if we treat itch, patients' perception of their disease improves, which can improve their quality of life. And then we discover that the stage of disease can further affect quality of life, and certain populations may be more susceptible to quality of life issues than others. And then we have that survey that really gives us specific targets that seem to be common offenders on the patient's quality of life with lymphoma. So now we can broaden our approach to patient care. Instead of just working on skin and screening for side effects of therapies, this is a complicated process of Dr. McBurney and Dr. Bowe's talk. I mean, you can see in one, clinical interaction, all the things that you have to go through. Number one, to get the diagnosis. Number two, to get an ineffective therapy. Number three, make sure you're not having a lot of side effects from that therapy. But still, we need to do more, and that is broadening our spectrum of care here and making sure we're taking the extra time and steps to make sure the itch is controlled, to evaluate sleep and find out if patients are tired, see what we can do there, screening these patients for anxiety or depression, making sure our treatments are accessible and affordable to our patients and not burdening them too much. And by extending our care, we can potentially positively impact our patients' quality of life and help them cope with this incurable disease. So as far as the review articles, I think that shows that there is hope and that we can make this better, even though that there is an association with a quality of life impact. So how exactly do we do this? How do we target these things? And for the purpose of this talk, I thought, we would stick to those common offenders, and we'll think about those three domains. So first of all, the skin symptoms, then emotions and function. So skin symptoms, the itch, scale, redness that can affect clothing choices and, bother people throughout the day. There are a few things that we try to remind patients of is things that are going to make that worse, like getting in really hot baths or showers. Oftentimes patients getting a scalding hot shower to calm down that itch, which definitely temporarily helps, but then 5, 10, 15 minutes later, that is going to be a trigger for a pretty significant itching episode. We try to recommend cleansers, not soaps, and it sounds like I'm saying the same thing, but cleansers are actually much more gentle to the top layer of the skin. Examples of cleansers would be like Dove soap, CeraVe, Cetaphil, Aveeno, and soaps are going to be like Dial, Ivory, all good quality products, but can definitely affect that top layer of the skin, okay? When you get out of bathing or showering habits, instead of taking that towel and, really going at the skin, rubbing everything, patting dry so we're not really triggering that top layer of skin to become irritated, and almost leaving like a little bit of water on top of that skin so that it'll help hydrate that top layer. Dr. Hazeltine showed that picture of the skin, and in that top layer, that bright pink or purpley part at the top, keeping water there can be helpful for hydration. So right after that, we want to put our creams on real quickly to lock that water in. We want to keep it in that top layer of the skin because it'll evaporate if you just let it go. But if you apply those treatments real quickly, it'll help maintain that moisture barrier. And regularly using moisturizers, not just right after the shower, but using them multiple times a day as needed for hydration to the surface of the skin. Avoiding fragrance and irritants can be real helpful here. I know like everybody I think uses Gain detergent and it smells good. It makes the whole house smell good. You walk into the patient room, you're like, you use Gain, you smell great. But that fragrance can be real irritating to the top layer of skin. So simple things like changing your detergent can be helpful when we're targeting itch. So I thought Dr. McBurney went over a lot of good side effects from their topical therapies. People get a lot of irritation from the therapies we're doing. So we're trying to treat the condition, but then they're having a side effect, whether it's contact dermatitis or some kind of irritation from the cream. So that's occurring, that's certainly something we need to become aware of during the interview. And then if these skin-directed therapies or topical therapies are not enough to improve itch, we do have medications that we try to improve symptoms of itching throughout the day, oral medications. Next up is function. I thought that the sleep, 66% of patients had felt tired every day and felt that their sleep was affected by the disease. That really stuck out to me. I had the misfortune of getting about 50 mosquito bites one time, and I was up all night scratching the mosquito bites because I was so itchy, and I just like kept thinking about my lymphoma patients, like, is this how they feel every night? Like how much this would affect their quality of life? It's got to be, a real thing that we have to address. So sleep, if itching is part of the sleep, certainly targeting the itch, but also helping our patients get a quality night's sleep, whether that is medication or discussing sleep hygiene. So I thought that the sleep hygiene was real helpful to review, and if we can make good sleep habits that may promote, a more consistent, restful night's sleep. So some of those things are having a consistent time and temperature and environment for your sleeping habits, avoiding screen time and exercise prior to going to bed, avoiding caffeine, alcohol, and certain foods before you go to bed, and having some kind of meditation or relaxation routine. So some people that would be reading a book or some kind of formal meditation or reading scripture, whatever people do, but make it a routine, a consistent routine that's kind of like training your brain to, okay, it's about time to go to bed. And then next up under the function would be homework function, just to assess whether, our light therapies that we're having you do interfering with your ability to function at work because you're constantly leaving at lunch and getting back late. All of those things would affect how we treat patients. The financial burden I also thought was, 61% of patients said that this disease was causing a financial burden for them. And if you see the price tags on these medications, you can understand why. I mean, they are crazy high. It is, like Dr. Bo said, it's a game. It's pretty challenging to work with insurance companies, drug companies, and then the pharmacies to get these drugs that are not made in, high quantities for our patients. So fortunately, a lot of the companies that make drugs for cutaneous lymphoma do have ways to make their medications accessible. But if we don't know that that there's a problem at the pharmacy, then we can't help. So that is that communication, and it is always a challenge to, be able to be involved in all of those steps of the way, but it's certainly a goal that we have to try to achieve and communicate effectively with the drug company, the insurance company, the pharmacy to make sure everything is on its way. We actually had at LSU, we had trouble with the communication part, and now we have a specific phone number that is just designated for our lymphoma patients so they can call us and not go through all kinds of loops and hoops and in the call system. And finally, emotional support. In our patient interactions, I often ask patients, what is their support group? Identify or tell me real quickly who's your support, and whether that's family or friends, whether it's a church group, a coffee group, or if it's something broader like the Lymphoma Foundation. This is a national group that pools people to help support each other. But knowing that, so when you do get in trouble, you are having those bad days, you know who you're going to reach out to. These people are identified, and you just reach out to them and call them. We use medication when appropriate, especially for depression and anxiety. We know that depression and anxiety can worsen our quality of life score. So if we help target those two things, then we can improve quality of life. And referral to a mental health professional when needed. So finally, I just wanted to talk about these, patient interactions. There's a lot to cover in a 15-minute office visit. I mean, it's a challenge to get the diagnosis. It's a challenge to get the right treatment. You may have side effects from that treatment that we have to address. And then holistically, broader, in a wider range, we're not just taking care of lymphoma, we're taking care of a human. And so we have to address those quality of life issues. So I think moving forward, being an advocate for yourself, I hope this talk empowers you to bring up some of those concerns, and hopefully your providers, as we learn more and more about these quality of life issues, will be initiating a lot of these conversations with you and asking the questions. Are you up all night because you're itching? Are you worried? Can I refer you somewhere? What can we do to improve your quality of life? And I think that teamwork, us working together, you advocating for those issues and us kind of screening and seeking them out, can improve patient well-being and patient experience with this condition.